Hi, I'm Dr. Julie Steinauer. Today I want to talk to you about April being Autism Awareness Month. Now, before I jump into talking to you about this, I do want to tell you how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com and you'll have two choices. You can either click on schedule a consultation directly with me and talk about how we might be able to help, or you can fill out a questionnaire and get some feedback about what might be going on with your vision. Now, let's go back to topic at hand, which is Autism Awareness Month in April. And there are some important things to know about autism and how it might be affecting your loved one's vision. But first, two staggering statistics. 1 in 37 boys is diagnosed with autism and 1 in 92 girls is diagnosed. This is a super high volume of children who are being diagnosed as autistic, and obviously there are many different variations as far as where that individual may fall on the spectrum and how it's affecting their ability to perform in school or maybe their social interactions, their behavior. So we do recognize that there is a wide spectrum of autism and its effects on an individual. Today we're just going to be talking kind of globally about what you can maybe possibly pick up with your child. So let's talk about some symptoms. First of all, it's really common to see in autistic children that they have problems with making eye contact. So poor eye contact is super prevalent. Oftentimes they'll be looking down at the floor, off to the side, or they just refuse to make eye contact when they're talking with someone. Another thing that is highly prevalent in autistic children is strabismus, or an eye turn. In fact, some sources cite that as many as 50% of children with autism have some type of strabismus. As an office that sees strabismus all the time, I can tell you I think that that number might be actually low. And so I do believe that there's a higher incidence of strabismus in autistic children, probably closer to around 90% is more accurate. It is also common to find that amblyopia or lazy eye may exist in autistic children, which is one eye doesn't see well as the other. And what happens here is that most children, whether they're autistic or not, don't necessarily have the capability of communicating that their eye's not seeing well. First of all, because it might not be to them a big deal. They've lived that way their whole lives, so they might not say anything at all about it. Because to them it's normal to have one eye that doesn't function as well, so why say anything? But also, obviously, with autistic children, if the communication level of communication skills is not quite where we want it to be, it may be difficult for them to communicate anything that's going wrong with their vision. Now, other things are tracking problems that they might have, generalized binocular vision or two-eyed coordinating problems. We can also see a lot of issues with sensory integration. Another one would be the fear of heights. So what happens in this particular instance is if they do have a strabismus or an eye turn, then they may not be judging their space correctly, or they might have a lack of depth perception or stereopsis, which would cause them difficulty with heights. That might mean that walking down steps is cumbersome. It might mean that going across decking or places that have like a grate where there's open space in between maybe one board or another, going up and down a slide could be a problem. And on the other spectrum of this, sometimes kids have literally no fear of heights and they're very kind of daredevil-y and they don't care at all, or they're not worried at all, and they'll jump off of anything with no fear or worry, no concern whatsoever. You know, much to the dismay of a lot of parents. So these are some of the visual symptoms, maybe signs that you could be seeing with your child. If you look into more details about vision and autism, there are lots of wonderful sites out there that you can jump onto that have tons of information, and certainly many things like COVD is a great, covd.org is a great website for further information. Now, also I think Optometrist Network has a lot of information as well. Now let's talk about what we can actually do to help and treat someone who is autistic who has visual problems. So one of the things that we do is something that we talk about really frequently, which is to use Photosyntonics, also known as just Syntonics, also known as photo light therapy goggles, which help the individual to almost like trigger the brain electrically to learn how to reprocess information. So if they have sensory integration issues, this actually can help them to develop better ability to process all of those sensory inputs and help them to be more calm. If we're talking about all of the vision issues that I kind of mentioned here today, there are specific filters that are designed to help, trigger the brain electrically and teach the brain how to reprocess vision more accurately. But in addition to using Syntonics, we do come alongside our patients and use something called just straight vision therapy, which is kind of like a combination of physical therapy and occupational therapy for the brain and eyes, in which we're teaching the individual how to have better binocularity, how to have better alignment, better tracking skills, and many of the things that I talked about here today, including the fear of heights and poor eye contact, will be improved whenever you electrically program the brain and then come alongside and physically train the brain and the eyes how to function better together as a unit. So if you'd like more information about how we treat patients who have autism, no matter where they're at on the spectrum, it doesn't really matter. We have some really awesome success stories of individuals in the past that we've worked with that were even kind of nonverbal, and that we worked with them using Photosyntonics or the Syntonics light therapy goggles, and it electrically kind of turns on some things triggering in the brain and processes, helps them to process information differently, and they start speaking and talking and reading and holding conversations and having better eye contact. There are so many amazing things that we can do. So go to our website at visionforlifeworks.com. You can read information there, but you can also, again, schedule a consultation directly with me, or if you're local, give us a call at 618-288-1489. And if you like this video, hit the like button. Make sure to subscribe so that you don't miss any of our videos. And clearly, if you know someone that you find this information could be helpful or beneficial, maybe this is like an answer to their prayers, please pass it on. Thank you.